Recording is on.
Specifically designed for psychotrauma. It's so important in Nigeria, and it's important all of us listen to it very well and ask questions. And I hope by the time it finishes, we'll all be able to start making use of it. Because the way the country is now, we need some structured thing to start doing the interventions we need to. There seems to be a problem almost in every part of the country. So, Dr. Abiola, yeah, can you take us through this? Please do it in such a way that so when we finish, tomorrow when we see people with trauma, we can start making use of the process. Thank you very much, Dr. Abiola.
Thank you very much, sir. I'm most grateful for the opportunity to present once again. I'm a bit worried in the sense that this is just an introduction, but I hope at the end of it, it will give at least some skills for us to be able to utilize in helping people with trauma. Because it will take more for someone to be able to use it systematically the way it has been designed. And thank you once again for giving me the opportunity and the rest member of the team to present on your behalf, sir, as the third session of introduction to indigenous psychotherapeutic interventions that were designed and being utilized in Nigeria. This is what I hope we will achieve by the end of today's session, so that we can appreciate what psychotrauma is in a bit, the impact of it, then why do we need the ultra brief intervention, then we'll identify the key components in it, recognize the structure and practical application of it, and appreciate the evidence supporting the ultra brief intervention's efficacy. To start with, psychotrauma can simply be defined as a wound to the psyche. The psyche referring to the mind and in some instances to the soul from highly stressful event that shatters one's sense of security, because it's something that occurred challenge our security, and from the challenges it takes to our personal and holistic security in all sense, it's keep making us to suffer, and those mind sufferings that we go through can simply what you might understand to be psychotrauma. And some people have tried to give it that what is the synonym of it. It's like a life quake. When earthquake occur, we know what happened and how the whole area that is affected is shattered. Buildings collapse. Some buildings uh, are subsumed inside the ground. A lot of damages occur. People died. But when this is happening to individual's life on its own, and that is as a result of whatever the trauma that occurred, that is not happening, affecting the life, the lived experience of the person, then that becomes the life quakes. The common features of psychotrauma, but not exclusives, are central to it is the feeling of helplessness and vulnerability, the continuous feeling that the threats that has upon my reoccur or might still cause more suffering for the individual, and this can affect the individual's safety, in a sense of safety in the physical sense, to his body or his possessions or properties or the environment, the social in terms of the relationship that he has shared and the loved ones, what might happen, all that, to the individual's psychological and integrity, the mind of the individual itself, the emotional architecture of the individual, and in some extent the spiritual well-being of the individual, where the person's purpose and meaning in life are severely affected, shattered, and the individual start asking the question, why me, God? Why did this happen, God? And so all this do happen during psychotrauma. And the emotional experience often associated determine the degree or the impact of the trauma, the depth of the suffering that might usually occur from the trauma. Common examples of things that can cause psychotrauma is violence, natural disaster, abuse, or kidnapping. And to re-emphasize again, psychotrauma is that suffering that follows the occurrence of this. It is not this in themselves that is the pain now. but it is what the individual, the wound the individual keep carrying around in the mind, in the soul of the person, that follows the trauma. That is the psychotrauma. It can be classified in so many ways. What causes it, the trauma, and we can look at it in terms of the nature of what is causing the trauma. Is it a verbal abuse, a betrayal event, a physical abuse, child abuse, elderly abuse, a major loss in life, collapse of one's building or one's house, loss of a job, uh, divorce, or some other life-threatening events like accident, flooding, the terrorism that we're experiencing in so many guys that it comes, whether we call it banditry and all other names that we might give to it. So this can be looked and to know that okay, this is what is a traumatic experience, the nature of it. But we can also classify it based on the duration of exposure to that event. And it can be acute when it's single and it's this may only incident. It can be chronic, where it can be repeated or prolonged. Domestic violence falls into this category. Other form of trauma might also fall into this, like the ongoing insurgency in Nigeria. They contribute to a lot of and as source of chronic trauma in in the uh, in our experience in Nigeria and globally too. We know a lot of trauma is going on, and I'm not going there to look at the nature or the type of people that are victimized. Then the trauma can also be complex when there are multiple, there are many invasive events that coalesce, all different trauma coming together, and the concatenation of them add more to the degree of the wound the individual suffers as a result of experiencing or getting exposed to the event. We should know that not all traumatic events lead to lasting trauma. So what we are looking at is that of course we know after a traumatic experience, some people do have post-traumatic growth. So they emerge from it stronger and better. They are more resilient and they move forward. But not all of us have this charisma, and not all of us might be fortunate to get to that extent. And when that do occur, for those that will be caught into this, those are the ones we are trying to focus upon. And we know that when trauma occur, there are traditional treatment available for them. These are typically the psychological intervention that has been done for this. Uh, there may also be, apart from those traditional psychological intervention, which are not easy to learn, which is also one of the reasons this group was created and the sessions we'll be having was there to increase our capacity to be able to give in one, at least in one modality, those psychological interventions. But when they are difficult, because they can see how long it takes, so because they are lengthy, for one to successfully they have carried out a well structured traditional intervention, whether it's supportive psychotherapy for trauma, whether it's cognitive behavioral therapy for trauma, which can be looked at as a cognitive processing therapy, or or all other form of CBT types that exist for trauma. And when we look at all this, the length that it takes to learn, the supervision that it needs for someone to go through to be able to have some level of capacity to be able to do it and give it to others, it's very costly and expensive. So that is one of the limitations. That's one of the challenges to those traditional treatment that is available. We also know in so many environments where resources are scarce, it also become very troublesome because the resources needed to train people or who are interested are so much. So we need a lot of resources to train somebody to become a specialist in this, and these are not resources that are readily available. And also, not everybody can just be picked and say, let's train you because you have had some level of learning already. No, you must have gotten to some higher level of learning before one might be typically be qualified or be found suitable to be trained for such traditional therapies. And also, we know, despite that, there may be few that have it, they are so scarce, and that limited their availability in crisis zone. They will not be willing to be present in the crisis zone. They will not likely be the first responder. And so this already denies opportunity to those that will benefit from their expertise. So this is challenging. If you look at some other method that's also used outside the psychotherapeutic domains and the pharmacological interventions, and these are also troubling there, because the people who are trained to prescribe with the prescription power to understand and make the right diagnosis of the outcome of the trauma that an individual might be going through is also challenging. Not everybody can really can just somebody experience this. So what is the proper label of what that challenge is? Is it just a toxic stress disorder that we'll be looking at in the individual? Is it post-traumatic stress disorder that the individual is suffering? Is it depressive illness that the individual is going through? Or anxiety disorders, any of them? That so there are so much that it's the level of expertise needed to diagnose before we can prescription is also challenging in these circumstances. So all this pulled together make them difficult and make the difficult challenging for people who are having the traumatic suffering to get the needed help. Many people who might be enthusiastic go to them, but they end up just being present. They might even complicate the suffering of the individual because they don't understand what might be evidence based to help to provide treatment for these people. So the current standard of treatment, which you call the traditional therapies, these are some of the limitations that are there, that are bounded, that make it difficult for us to do. So readily available to individuals who are going through traumatic experience. And this calls to the sense that, okay, if you have the so-called short therapy, which I've tried to describe above, that it takes about 12, minimum of 12 sessions, and it might go as 40 sessions. If you have those short therapies and they are difficult to understand, to learn and implement, then we might be thinking of what are the shorter forms of such therapies that may exist. And there is hardly none that are available. For those that we might find, there are also challenges with them because of proprietary rights, the cost implication of trying to learn them, use them, implement them. So many things there. And that bring one of the challenges while we're looking at, okay, then there will be need to look for more shorter form of therapy for psychological trauma that will be of great help to individuals or victims of traumatic event that might be due to conflict, disaster, violence, and all the modern day troubles that can make somebody to have a psychological wound afterwards. And because of the inability to access resources to train people, they were looking at what that people with some level of knowledge can be trained within a short possible period of time so that they can grade this and be able to use it like a kind of an intervention between a first aid and a traditional treatment that may be indicated, which might be restricted maybe to few places or few institutions. So that being said, it is being looked at, and in that way, we're trying to look at it that, okay, when there's those limitations, then the brief therapy will be indicated, and that can be of help to so many people who will serve as frontline responders to traumatic victims. And so the time and resources constraint to train people, we're looking at what will be available, what can be done to help those people to be able to learn it within the shortest possible period available, being supervised, and when all those is done, they can go and implement it and help people who are going through trauma. And that is one of the things that leads to the creation of the ultra brief therapy for psychotrauma. And the ultra brief therapy for psychotrauma, which is what I will try and discuss briefly Henceforth, it's a 5-session manualized intervention for rapid relief. It is suitable for first responder with basic training, e.g., community health workers. What are the things that serve as a foundation or that guide what to be done? Like we know, for us to say a treatment should work, we should have a strong foundation for it. And that's where one of the foundation that starts for it is one of those things that we understand to be psychological recovery. In mental health, in psychology, and other social sciences of relevance, the concept of psychological recovery is built on 4 pillars. That if somebody should go through a psychological pain, a traumatic event, what are the things that if the individual is given, is the capacity of the individual is built in that, the individual is able to enhance him or herself in those through some intervention or otherwise, that it will help the individual to recover. And so this individual has gone through this. He has the pains and suffering have reduced. The individual have recovered and is on the journey towards post-traumatic growth. So that's what the concept of psychological recovery is talking about. And the 4 pillars of psychological recovery are hope, self-identity, meaning in life, and responsibility. So, and this is understood that for most psychological intervention itself, that once they are successful, they should be able to at least boost these 4 aspects. Hope, in the sense that it tries to help to foster optimism and create a goal-directed thinking for the individual. Hope in this instance is not looked at as the feebleness of just trying to make somebody feel happy, just trying to tell somebody, don't worry, it will just be over. No, you're trying to look at it also more from the scientific viewpoint, where the Schneider was able to look at it that the individual as an agency on its own will be able to know that whatever happened, they have a belief, that capacity to believe that things can change, which is the goal the individual will set, and I have to take the responsibility, which is the law, to move through that pathway that I need to go through, so that to be able to overcome the obstacles, that suffering that's lying there, that's I'm going through, so that I can overcome and get out of it and get towards the wellness part. That's the recovery part. So the hope in this sense is looking at that. So it's a more robust concept in psychological recovery. And we know all therapy, the one way or the other, work to boost the individual's hope. And another aspect of this is that self-identity. And we know whenever there's something that challenges our psychological wellness, one of the things that it also challenge is our sense of self, our selfhood, our I do concept. And so these are usually challenged that why am I the one who break down? Why is the other person functioning? Why should this happen to me in my own community, or this event that is happening? Why am I the one that seems to keep experiencing? So when all those things come challenging the personal narratives, the personal stories we have grown up with, we have been sculptured with socially, and when those narratives are being challenged, then we need to find a skill-based way to reconstruct it, so that the individual can grow from that suffering, because the suffering creates a new narrative that continue to empower the personal suffering of the individual. So in order for the individual, then there have to be a way to help the individual go through that. And that's one of the focus of what the other brief therapy is trying to do. That's one of the skills that is trying to give people coping capacity in many more ways, and to also make the coping capacity meet the cultural sensitivity of our people in Nigeria. That also come with the third pillar of psychological recovery, which is meaning in life. I know along the line, one of the first indigenous psychotherapy discourse here has to do the good monotheistic existential therapy, which looks more about this aspect of existential suffering. But in this sense, it's not looking at it only as an existential issue. It's looking at it more holistically in the spiritual sense of it. To look at when this happened, how did it affect the spiritual well-being of these people, so that their sense of purpose and direction will not be lost, will be well preserved, or will be re-engineered for them, so that when people have that sense of purpose and direction, the meaning in their lives, those narratives, like I've said, that the individual is going through, take a better understanding, and they are able to place in proper context what the supreme being in life is doing for them, the benefits that they are likely to hit, the the opportunity that lies in being a trauma survivor, and what they need to do in order to keep growing there towards that purpose and direction they look at. And this is be more meaningful when we also remember one of those things we have learned here, when we look about behavioral activation, when we talk about values in life. These values will also be looked at. The individual will be able to understand, oh, where am I in my value system, looking at it from the Abraham Maslow hierarchy of needs. And we want the individual to be able to grow from where he or she now be as a result of the trauma that has put the individual only at that survival level, looking for those basic physiological needs, where the trauma is also trying to help challenge us so that they can link up to those transcendental experience, which are very vital to help recovery and make it more holistic. So it also teach that as part of the wellness recovery. And it also challenge that for me to recover, I must also take these necessary steps. I must do it in a systematic way. I must take responsibilities for it. And in that way, we are not just giving the individual the tools to use. We empower the individual so that they will take those active steps towards the pathway of recovery. So that is why the hope, the self-identity, the meaning in life, and the response, they are intertwined to help the individual to recover. And this is the basic concept that underlines why the ultra-brief therapy for psychotrauma is first feasible. And based on that, then that help that, okay, when this treatment is being created and being developed, and with the expert that lies there, like our father here, Professor Owedo Idofia, Professor Judo Eri, my other colleagues, Dr. Fajimolu, Dr. Abdul Wahab, Dr. Asambala, that when some of these have been developed and we also try to test it, these people play a lot of role in all this to help in the, and we find that this street therapy is weaved to be able to achieve psychological recovery by promoting the following four elements specifically. And that is, it should be able to enhance hope by teaching hope enhancing skills, which goal setting, visualization, positive outlook through narratives, not just to talk positively, not just positive thinking, but what are realistic narratives that will help the individual to move and succeed and get out of the trouble. Another thing that also looked at is to give problem solving skills. Problem solving as a therapy is holistic on its own, but some elements are also very vital to help the individual to be able to go through the challenges and the suffering of psychological trauma that may be going, so that will help them, so that obstacles, that the suffering, the wound that is created because of that obstacle of event that occur, they will be able to get over it and move forward, and such recovery is being attained. Then we also bring one of those concepts that looks challenging in the modern world, and that's the concept of wisdom. Wisdom coping becomes one of those things that help to attain that second and third aspect of psychological recovery that I mentioned earlier on, when we talk about the meaning and purpose in life, and when you look at the self-identity. Wisdom coping is one of those things that help us to be able to go in. And wisdom as a scientific concept is one of those concepts that is also, that just like hope, that are multifaceted. It's not one thing that we could just call wisdom. It's not just because somebody is elderly now that we say it's wisdom. No. For our elders, we know they have gained the benefit of wisdom, but that they've grown in so many capacity. And they include the sense and capacity of forgiveness, self-forgiveness and forgiveness of others, the capacity of appreciating what self-care is and what self-kindness is as distinct from narcissism that people may practice, and other concepts that are there in the work of wisdom as carried out Philip Jesty. And there's an instrument to measure that, to measure the degree of wisdom that people have. So this is one of those things that were integrated to see that the skills is being built by this treatment, and also to also use that wisdom aspect to further enhance the spiritual skills, because it's through there, because one of the last component of the wisdom as a motivator is spirituality. So the wisdom coping skill is used to enhance the spirituality further, so that the individual can have the better, deeper meaning in life, so that it can boost their recovery through the spiritual practices of common humanity that we all shared and that we know we can grow and recover from. So these are part of the key issues and key things that the ultra brief therapy for psychotrauma address. What are the components of things that usually when somebody's carrying out an ultra brief, or why did it work? It works because it helps to set clear goals, achievable, that is smart goal for the individual who are going through trauma, so that they can recover from it. And like typical of what Hope plays, the pathway they must walk is they were able, they are helped to be able to work on that pathway by giving them the necessary problem solving skills, activities to navigate the obstacle that is tying them down, that is worsening their pain, the suffering they are going through. It helps build the self capacity now and the agency they carry, and that way their self-efficacy is enhanced and their resilience is also built in the process. It also helps them to appreciate that what has happened to them occur also in the relationship context, and that is very vital because it helps them to explore their intrapersonal, the interpersonal, and the transcendental, because we have said that this aspect of this have to look at spirituality. So the transcendental is also the relationship they share, which are usually shattered because of traumatic events. And it also boosts the wisdom coping and spirituality practice and coping in the sense. So these are the components of actions that usually when somebody go through the training should be able to effectively carry out to help this individual who is suffering and going through that. And how does the session goes like? And like I've said, it's an ultra brief. These are usually ultra brief interventions, psychological interventions are usually expected to be less than 6 or less than 6. And this is a 5-session treatment. And each treatment is an average session of about 60 minutes or maximum of about 90 minutes. It ranges between that. And each section structure begins like following the normal typical psychotherapeutic modality. There's a beginning part, the middle part, and the ending part. The beginning has to do with the check-ins, the middle part has to do with the core skills that's needed, the practice of it, and the ending has to do with ending the day's activity before the final session termination comes in. And also in the process, assignments were given. Those are in the typical cognitive behavioral therapy format. And we also try to modify it in this sense to see that most of the people might meet might not be formally educated. But since most do have access to Android phone with recording capacity, we try to modify it to meet the needs of our cultural context. And that way we encourage them to record their homework given to them through a verbal narration, which will now be used in the subsequent session. And these assignments have been graded in a way that will help them to practice what took place in the session and to see that they get and recover from it. So each session primary goal, there are more than this, but the first session is to try to create a psychotrauma foundation. And through that way, that can help the individual to start understanding, oh, why I or we are going through this pain, why this is how it leads to. And through that way, it helped them to understand the trouble, the problem they are going through. And that way, we're able to move forward so that when the next session comes, which is initiated in the first session, is that we initiated the hope recovery skills given to them. And the second session, we fostered the hope recovery skill further, and we added other coping strategies to it, which I have discussed about, some like problem solving skills that take place there. This will enhance and more in the fourth session using wisdom coping skills, because I will keep emphasizing from that this session is 5 sessions. So the actively you work with it and help, the better, and it will help the individual to be able to cope so that they can lead. When the 5 session come, they will not become dependent on the provider, and they can. And part of the training is also for the provider. If after the 5th session the individual still did not recover well, or we felt the individual did not benefit much, then that's time as a grant for referral to a more well-trained individual in the traditional therapy, that the individual can go through a more longer sessions, or with or without medication, depending on whom the individual is referred to get this. So essentially, these are the brief about the sessions for each individual when they come, and each usually run for like 5 weeks, so that a session lasts about an hour or more, and that goes through, and the individual go through this activity, they practice it throughout the week, and all this work together to help them get over this. But this looks simplistic the way it has been presented, and in order for us to be sure that what this therapy is, with a strong foundation from the psychological recovery concept, with the well organized, manualized therapy format, the individuals were trained and to be able to apply it and to get the efficacy of it. A study was carried out, which was accepted and published locally, the Nigeria Journal of Psychiatry. And this provides the evidence that we need. The summary of the artwork is that, let's go to where people actually are suffering. Of course, before this, individuals have come with different psychotrauma, either referral because they are victims of trafficking or otherwise, and this has been carried out for them. And so there are many sources that have come, and this has been one-on-one sessions to see the efficacy. They say, no, we need a more robust data, no matter how we took in the field and see. And this is what engineered is, so that a more robust evidence. And so this is a case control study that look at some of the people there in the IDP camp located in Nigeria. And for people who are more interested, they can go and look for the full article, or it might be shared on our page subsequently for people who are to learn more about it. And that way, we have a case control where people there, we see that they go through the cases, go through the intervention, the control, receive treatment as usual. And at the end of the therapy, the control are also given the treatment so that they can also benefit from that. And there are many measures that were used, but was found is this, that at the end of the 5 sessions that was done, it was discovered that the PTSD symptoms that was measured among these people in the IDP camp, there's more than 50% reduction in the PTSD symptoms among the cases, compared to about 10% among the control, because we say they are receiving treatment as usual. So they too, they experience some recovery in their PTSD symptoms, reduction in it, but it's about 10%. But for the people who actually went through this treatment, their recovery from it is about 50%, which it shows that yes, they are improving more. And in order for us to test that, based on the premise that this therapy was designed from, that we expect it to improve hope, wisdom, and to also improve recovery from trauma, some instruments were also used to do this. And we find that there are significant improvements in their sense of hope, their wisdom as related to trauma, and the trauma recovery skills that was used also helped to show that yes, this individual improved and actually are recovering from trauma, which shows that this is one of the things that this ultra brief treatment is effective in the 5 sessions that it is. And we also try to calculate the effect size of it. And very interesting, the least effect size that was discovered in this, looking at the partial eta squared, is zero point 0.5. Some is as high as 0.9. And based on the effect size using the partial eta squared, once the effect size is greater than 0.14, it is considered to be large. So this is very large because it's 0.14 compared to 0.5. You can see the difference. So this is like 5 times more. If the effect size is 5 times more larger than the typically expected from it. So this contributes to it that the ultra brief therapy for psychotrauma is practical, it is rapid, and it is scalable intervention that many can learn. Of course, this session is to introduce us to it. So the act and practice of it takes more time than the hour allotted for this introductory session of the lecture. So this is one of those things that is there that we felt is important to let us know things that also happening locally in terms of the growth of psychotherapy skills and practice in our country. Some more other practical implications from the work is who can deliver ultra brief therapy. So who are the people that we felt that they are qualified to be trained? We look at it that at least the person must have at least 14 years of educational qualifications. And if you look at what is 14 years, we look at it from our 6334 system. We felt that somebody who has finished secondary school education and had 2 additional years of training in a health related course or any other thing that may be looked at that may make the person to be a first responder, or somebody who have already trained as a counselor or a psychologist, a social worker, a mental health nurse, or an other expert in mental health, that this is one of those skills that will be suitable for them to learn. They can apply, and based on the outcome of the research, and we know it's very effective and helpful when people diligently do it the right way, and they will keep following you and monitoring so that we can look at and see whether somebody might need more additional help or not. So this is it. So in conclusion, and what I want to show is that the ultra brief interventions, interventional psychological psychotherapies, they are effective. There are few of them, but this was created in our environment so that the bureaucracies and the other challenges that may be bringing something from a different culture that may challenge the practical understanding of the sensitivity of the typical Nigerian cultural diversity and spirituality, that we need to create something. And this therapy seems to fulfill one of it. Like just like the other indigenous therapy that have been created for other ailments too, like the Maiduguri molestation, is also looking to fulfill the cultural sensitivity that is unique to us. All the methadone therapy is also looking at that has been created to meet our cognitive needs locally. All the one by Professor Ebigbo, the harmony restoration therapy. So all this together, and Professor Awarita Fair and all their works have all come together to show that indigenously developed therapy go a long way to meet our needs, practical needs, and not to bring it just solely from the Euro-American perspective, but something that looks at our needs, but also fulfill the Euro-American. So, what it tries to balance the worldview, and so that individual can adapt it in their way and look at it. And it's borrow from all form of existing therapy. That hope is very essential thing that we must learn how to enhance. Problem solving is one of those skills that is there. Wisdom, coping, and spirituality enhancement are all part of what this focus on, and it helped the needs of our trauma induced or infected in Nigeria. And it is ideal because the resources needed to train people are less compared to the other traditional treatment. And we can treat first responders there to with this case so that they can be very effective EPA, not just people just there, present there, and they could hardly provide the necessary EPA or skills needed for this. So I would thank everyone here while I'll be waiting that the discussion will bring more things up and the session will continue. Thank you very much. I'm very grateful for the opportunity to present on behalf of all the authors and the designer of the therapy. Thank you, sir.
Yeah, thank you very much, Dr. Abiola, for another good presentation. I think we should, I don't know, we'll talk about that one later. Thank you very much. And I thought the clapping that is going on in the place is a true reflection of how people feel about this. Now, I have two sets of questions, one question. Now, so normally like we do, would be open for a few, maybe 10 to 15 minutes where we have discussions on it. Discussions will go on in the chat group, but we have time, so we can actually start with a few discussions. Now, I am asking the question because the word wisdom, the choice of the terms, for example, wisdom, wouldn't it make people a bit more suspicious? How is this wisdom different from insight or enlightenment? Well, even enlightenment is not good enough. How is it different from insight? I've just asked about one of the components, that component called wisdom. How is it different from insight? Why isn't it called insight? That's actually the question.
Okay, thank you very much, sir. It's one of those concepts that has been troubling and challenging, and each time it's come up, not for you, you know that, but you're asking because of our own sake that people do look at what is wisdom. Like you've said, most people that it's not just to have an insight or to develop more insight or to have a capacity to contemplate, but the wisdom in this sense is used from the scientific research work of Justin Dilip and colleagues in North Carolina, because they help us to be able to bring it up. It's just like the concept of hope, that we know hope is not just a mere wishful thinking that things will change. Those are false hope. They are just mere wishful belief. Hope, that's why scientifically it's conceptualized that it is multifaceted. It has many components of it, and until all those components work together, then we cannot say this person is hopeful enough to recover. So that's the same way wisdom has been used in this concept, in this term, and based on the work of the scientific work of it. When we look at what are the facets of wisdom, and that have led to the creation of wisdom scale, which we call uh, San Diego Wisdom Scale, SDWISE. The short, and then in this study that we do, we use the short form of it, but there's also the long form of it. And look at it that wisdom has 7 facets. And one of the facets, which we all know, that for somebody who is wise, they must be able to control emotion. So they have high level of emotional regulation. So which distinctive from just having an insight. Then another thing to look at it that when you say wisdom is also to have self-reflection ability. And this is the contemplative aspect that some people believe that once you can contemplate, it means you are wise. But no, it's more than that. Wisdom encompasses that too. Then it also look at the level of tolerance that people can have for divergent views so that you don't judge people, which is one of those core skills that is needed when somebody is training to become a psychotherapist. Should be able to be non-judgmental in their values and be able to look at different views and stay focused on what it needs to do to help. So the tolerance for those divergent value system is also part of wisdom, which is scientific look at it. And another thing that's also look at it, apart from that, is also to look at the ability to make decision, the decisiveness of the individual. Decision making is one of those difficult things. But for people who are elderly, which is also why they were referred to as wisdom, because they look at them as what? The big data. They've lived through life. They've get data right from the time they were born to now that they are existing. So for somebody younger who want to say I'm wise, he cannot make such decisiveness because he doesn't have enough data to be able to look at what I'm going through or what is happening. This is where it has been handled before. And that's why we lean on you, our elders, because you have all this part and be packaged for you. Have that big data that each time you come, say, okay, yes, I've handled cases like this. This is the way we deal this. And it helps to help in the process of decision making so that the individual will not make many false decisions that will almost always lead to an unintended outcome. Then there's also the aspect of social advising, which has to do with our sociableness, which help us to be able to know what the relationship should look at, how the relationship should go by. And in a way, it's slightly related to pro-social behavior in the sense that it also, which is part of wisdom, that it helps us to be able to appreciate that I need to help others, the need for me to be kind to others. So that kindness, the pro-social behavior, also play a role there as part of wisdom. And also is spirituality that is expected. The more wiser somebody should become, there should also be a function of their spiritual practice. And that's why concept like forgiveness and though are also part of it. So that's why the wisdom in this concept is looked at from the scientific viewpoint, not from the loosely used and by so many people in the community of just from mere philosophical viewpoint, but the scientific weaving of what this concept should be. And that is one of the value of what science has brought. It has helped us to see that wisdom is not one thing. Wisdom is culmination of all this and ability to use them together to bring them, and that makes that distinction, that brings that help that is needed so that people can be able to use it to grow and overcome the suffering, the psychological suffering that they are going through. There is the brief answer on this, sir. Thank you very much, sir.
Well, thank you very much, Dr. Abiola, for the long answer. I think it's quite clear that you took time to say all of it. Thank you very much. Before we go on, only